Do you actually know what doctors and craftsmen have in common? That's right, they also use a kind of toolbox to tackle problems in a variety of ways. I've taken that quite literally and brought along 3 work tools here. Each of them represents a specific form of therapy used in the treatment of cancer. So, the scalpel or knife is representative of surgery, the pills, or alternatively an infusion are for administering chemotherapy, and the flashlight is a fitting metaphor for radiation therapy. The specific conditions for when each of these is used are clearly defined. Because for many types of cancer in children and adolescents, there is a prescribed therapy protocol. It specifies exactly when each step is to be taken and how to proceed. It's like a kind of instruction manual. Such a protocol is usually developed by experts over many years. It then represents the current best strategy against the specific type of cancer. But let's take it step by step. You clicked on this video because you want to know when radiation therapy is actually considered for children and adolescents. That essentially depends on 2 criteria. First, what type of cancer are we dealing with? And second, what is the goal of the radiation treatment? So, what is the treatment goal? Let's start with the first question. What type of cancer? Radiation therapy is a tool used to destroy tumors. Basically, it can be used for many different types of cancer. However, radiation therapy is especially important for children and adolescents with tumors of the central nervous system. These are located either in the brain or in the spinal cord. That is the central nervous system, the brain and spinal cord. But germ cell tumors, soft tissue tumors, bone tumors, and lymphomas are also frequently treated with radiation. All of these types of tumors can basically occur anywhere in the body. And all the tumors I just mentioned have in common that surgery alone is often not enough to remove them. This is the case, for example, if the tumor is very large or is growing into an organ that you don't want to damage, and this is where radiation therapy comes into play. It can first be used before surgery to shrink the tumor. This gives the surgeon a better chance of removing everything without damaging healthy tissue. However, radiation therapy can also be performed after surgery to destroy cancer cells that remain in the body. There are also situations where a surgical procedure is not possible at all or is far too risky. In such cases, radiation is sometimes used as the sole form of therapy and can offer good chances of a cure. This is the case, for example, with what is known as retinoblastoma if it is diagnosed early. In such cases, the tumor located in the retina of the eye can be destroyed by radiation therapy without significantly impairing vision. However, radiation therapy is most often used as a supportive tool. That is, in combination with surgery and chemotherapy, or just with chemotherapy, to attack the cancer in different ways. By the way, how well a tumor responds to radiation therapy depends on its sensitivity to radiation. Because naturally, tumors that are sensitive to radiation can be treated with a lower dose than those that are more resistant to radiation. For example, lymphomas or certain germ cell tumors require only a low dose to be destroyed. Bone sarcomas, on the other hand, require a high amount of radiation. Usually the total dose, that is, the entire amount of radiation needed, is divided into many small individual doses, which are administered on separate appointments. This is called fractionation. Complicated word. This is done so that the healthy cells have enough time to recover and repair themselves during the breaks in between. Because it's simply not possible to completely avoid that some of the normal tissue also gets exposed to a bit of the radiation. So that was already quite a lot of information. Finally, let's address the question, what is the actual goal of radiation therapy? In other words, what is the treatment objective? We've already talked a lot about how radiation therapy is often used in children and adolescents to destroy the tumor as completely as possible. In this context, the treatment goal is curative. This means that everything is done to completely remove the malignant cells from the body and cure the disease. However, radiation therapy can also be useful when a complete cure is not possible according to current medical knowledge. In this case, doctors also refer to a palliative treatment goal. The main aim then is to ensure that the tumor does not continue to grow, or that it becomes smaller. This is also intended to relieve pain and other symptoms. So the focus is on prolonging life and alleviating symptoms. That too can be an absolutely worthwhile goal. In any case, you can be sure that your doctors will always carefully weigh the benefits of your treatment against any possible health risks. and they will take as much time as needed to answer all your questions. If you want to know exactly what happens during a radiation therapy session, then be sure to watch the video afterwards on how a radiation therapy works. There, you'll also find out what your child or you as a teenager can expect during a radiation session, and how you can prepare for it.